With kids going back to school this week, that means they have to be prepared beyond supplies. They have to have those vaccinations. And to talk about that is Dr. Seth Brown from Niswonger Children's Hospital. Thank you so much for joining us. Now let's go ahead and just talk about those vaccinations. What are the basics that kids need before they go back to the classroom?
So I like to think about vaccines at certain ages instead of which specific ones they need. If we are having our children into those well child checks at 4, there's a 4 to 6 year old range. There's a series of vaccines that kids get during that visit. And then there's another set at around 11 to 12 years old. And if you are going to those well child checks, your primary care provider or health department, they do a wonderful job at making sure that the children are up to date on those series.
And why is it so important to be up to date on those vaccinations?
So there are illnesses that, quite frankly, quite a few of us haven't even seen in our lifetime because of vaccines. They are exceedingly safe, and they're one of the best measures to prevent illness and infection.
And you do mention diseases that we haven't seen because of vaccines. Now, with polio, we are seeing some cases there. Is that a concern as we go back into school?
We are, and it's definitely a concern that we always have to keep on the radar. Thankfully, they are overall exceedingly rare, but as we fall behind on the usual vaccination schedule, those vaccines, the protection that those vaccines give, it may not be there, and those illnesses can recur.
And is there a time frame for when people should be getting these vaccines for their children? Like how soon before school?
Well, I think the most important thing is every birthday, remember that they probably need to be in for a well child check. And at those well child checks, those are wonderful opportunities to make sure that they are on track. So the sooner the better, obviously, but it's never too late to go ahead and get that well child check scheduled to make sure that your children are up to date.
And something different this year that we're dealing with, COVID vaccinations. Now, those kids are eligible for it. So how will that play into vaccinations?
Absolutely. We are very excited that the safety has proven itself from the perspective of feeling good about giving vaccines to children younger and younger. And it not only protects the children themselves, but family members who may be at risk with chronic medical conditions as well.
What are some of the vaccines that kids should have?
Well, again, the 4-year-old series, those are going to catch you up on things like MMR. Tetanus vaccine is going to come in at around the 11-year-old. There's a long list of the recommended vaccines, and again, you don't even have to worry about each specific one. Just go to your primary care, and they have it listed out by age exactly what your child will need.
So overall, your recommendation is to go to that doctor, keep track, right?
Absolutely. Go to your primary care provider, go to your local health department. There are a lot of great venues where you can make sure that your children are up to date and protected.
What should parents know about vaccines for their kids?
I would make sure that folks remember that they are exceedingly safe, and complications from the vaccines are very, very rare. And I say that as a pediatrician and as a father.
All right, Dr. Brown, thank you so much. So if your kids have not gotten those vaccinations, there's still time before they start back into the classroom.